Hello, and welcome to today's video. We'll be talking about a subject that's crucial for women's health: vaginal cancer. Though it's a rare form of cancer, knowing the causes, symptoms, types, and treatment options is important for early detection and effective management. In this video, we will cover what vaginal cancer is, the causes and risk factors, symptoms to watch out for, different types of vaginal cancer, and the available treatment options. Let's dive right into it. Vaginal cancer is a rare form of cancer that occurs in the vagina, the muscular tube that connects the cervix to the external genitalia, also known as the vulva. The vagina is sometimes referred to as the birth canal. While vaginal cancer is rare, it can be serious if not detected and treated early. This cancer begins when cells in the vaginal lining start to grow uncontrollably, forming a tumor. It most commonly affects older women, but can occur at any age. Most cases of vaginal cancer are secondary, meaning they have spread from other parts of the body, such as the cervix or uterus. Primary vaginal cancer, which originates in the vagina itself, is much less common. Please consult your healthcare provider for more information on vaginal cancer. If you have any concerns or symptoms, don't hesitate to contact your healthcare provider today. Early detection can make a significant difference. Like many other cancers, the exact cause of vaginal cancer is not always known. However, there are risk factors that increase the likelihood of developing this disease. Let's discuss some of the most common causes and risk factors. The most significant risk factor for vaginal cancer is a persistent infection with HPV. HPV is a sexually transmitted virus that causes changes in the cells of the vagina and cervix. While many HPV infections go away on their own, some strains can cause cancerous growths. Age is another major factor. Vaginal cancer is most commonly diagnosed in women over the age of 60. This does not mean younger women are immune, but the risk increases with age. Women who have had cervical cancer or cervical dysplasia, which are precancerous cells in the cervix, are at a higher risk of developing vaginal cancer. This is because both conditions can be linked to the same risk factors, including HPV. Women whose mothers took diethylstilbestrol, a synthetic form of estrogen prescribed to pregnant women from the 1940s to 1971, have a higher risk of developing a rare type of vaginal cancer called clear cell adenocarcinoma. Smoking increases the risk of vaginal cancer, especially in women already infected with HPV. Tobacco can damage the DNA in cells, leading to cancerous changes. Women with a weakened immune system due to conditions like HIV or from using immunosuppressive drugs are at higher risk of developing vaginal cancer. A weaker immune system is less effective at fighting off HPV and other infections. Women who have undergone radiation therapy in the pelvic area for other cancers, such as cervical cancer, may be at a higher risk for developing vaginal cancer later in life. It's important to recognize the signs and symptoms of vaginal cancer, especially in its early stages when it's most treatable. However, in the early stages, vaginal cancer may not cause any symptoms, which is why regular gynecological exams are crucial. Here are the common symptoms of vaginal cancer. One of the most common signs is unexplained vaginal bleeding. This can occur between periods, after sexual intercourse, or after menopause. Another common symptom is unusual watery discharge, which may be accompanied by a foul odor. Women with vaginal cancer may experience painful intercourse, also known as dyspareunia, due to tumor growth or changes in the vaginal tissue. Persistent pelvic pain that doesn't seem related to menstruation or other common causes can be a sign of vaginal cancer, especially if the pain gets worse over time. In some cases, women may feel a lump or mass inside the vagina. This can be detected during a self-exam or a pelvic exam by a healthcare professional. Cancerous growths in the vagina may press on the bladder or urethra, causing symptoms like frequent urination, difficulty emptying the bladder, or pain during urination. Tumors in the vaginal area can also press on the rectum, leading to constipation or changes in bowel habits. Vaginal cancer isn't just one disease, it has different types, and treatment can vary depending on which type is diagnosed. So, let's go over the main types of vaginal cancer. Squamous cell carcinoma is the most common type of vaginal cancer, accounting for about 85% of cases. It starts in the squamous cells, which are the thin, flat cells that line the vagina. This type of cancer tends to grow slowly and often develops in the upper part of the vagina, close to the cervix. This type of vaginal cancer starts in the glandular cells of the vagina that produce mucus. Adenocarcinoma is more likely to spread to other parts of the body compared to squamous cell carcinoma. There are two subtypes of adenocarcinoma. Clear cell adenocarcinoma, linked to exposure to DES. This rare form affects younger women. Mucinous adenocarcinoma, a more common form that generally affects older women. Vaginal melanoma is a rare form of vaginal cancer that begins in the melanocytes, the pigment-producing cells in the skin and mucous membranes. Melanomas can appear as dark patches or lumps in the vagina. Vaginal sarcoma starts in the connective tissues or muscles of the vaginal wall. This is another rare form of vaginal cancer, with subtypes such as leiomyosarcoma and rhabdomyosarcoma. It is more common in children and younger women. This is a very rare and aggressive form of vaginal cancer that contains both carcinoma, cancer of epithelial cells, and sarcoma, cancer of connective tissue. Carcinosarcoma requires more intensive treatment because of its fast-growing nature. To diagnose vaginal cancer, your doctor will begin with a pelvic exam and may order additional tests, such as Pap smear, a routine test to detect abnormal cells in the cervix or vagina. Colposcopy. A special magnifying device is used to examine the vagina and cervix more closely. Biopsy. If abnormal tissue is found, a small sample will be taken for testing to confirm the presence of cancer. Once vaginal cancer is diagnosed, it is staged to determine how far it has spread. The stages range from stage 0, when cancer is confined to the surface of the vagina, to stage 4, when cancer has spread to other parts of the body. The treatment for vaginal cancer depends on the type, stage, and overall health of the patient. Treatment options may include 1. Surgery. Surgical removal of the tumor is often the first line of treatment for vaginal cancer. The type of surgery depends on the stage of the cancer. Local excision. For early-stage cancer, the tumor and some surrounding healthy tissue are removed. Vaginectomy. This involves removing part or all of the vagina. In advanced cases, nearby tissues or organs may also be removed. Pelvic exenteration. In rare, advanced cases, this radical surgery may be required to remove the vagina, along with parts of the bladder, rectum, and uterus. 1. Radiation therapy. Radiation therapy uses high-energy rays to destroy cancer cells. This is a common treatment for vaginal cancer, especially in cases where surgery is not possible. Radiation may be delivered externally or internally through brachytherapy, where a radioactive device is placed inside the vagina. 1. Chemotherapy. Chemotherapy uses powerful drugs to kill cancer cells or stop them from growing. It may be used in combination with radiation or surgery for advanced vaginal cancer. Chemotherapy is also used if the cancer has spread to other parts of the body. 1. Targeted therapy. In some cases, targeted therapies that attack specific cancer cells without harming normal cells may be an option. These drugs work by blocking cancer cell growth or the blood supply to the tumor. 1. Immunotherapy. For advanced vaginal cancer, immunotherapy may be considered. This type of treatment boosts the body's natural defenses to fight the cancer cells. Let's wrap up by answering some frequently asked questions about vaginal cancer. 1. How common is vaginal cancer? Vaginal cancer is quite rare, accounting for only about 1 to 2% of cancers in the female reproductive system. Most women diagnosed with vaginal cancer are over the age of 60. 1. Can vaginal cancer be prevented? While it's not always possible to prevent vaginal cancer, certain steps can reduce the risk. Get vaccinated against HPV. Regular pap smears and pelvic exams can detect abnormal cells early. Avoid smoking as it increases the risk of cancer. Practice safe sex to reduce the chance of HPV infection. 1. What is the survival rate for vaginal cancer? The 5-year survival rate for vaginal cancer depends on the stage at diagnosis. For early-stage vaginal cancer, stage 1, the survival rate is 75 to 85%. For advanced stage cancer, stage 4, the survival rate drops to about 15 to 20%. Early detection is key to improving outcomes. 1. Is vaginal cancer the same as cervical cancer? No. Vaginal cancer and cervical cancer are two different cancers that occur in separate parts of the reproductive system. However, they share similar risk factors, such as HPV infection, and can sometimes occur together. Vaginal cancer is a rare but serious disease. Early detection is vital, so regular gynecological checkups, paying attention to your body, and knowing the risk factors are crucial. If you have any concerns or symptoms, consult your healthcare provider as soon as possible. Thank you for watching. Please like, share, and subscribe for more informative videos. Feel free to leave any questions or comments below. We're here to help. For more information, visit our website and follow us on social media for the latest updates and support resources.